Good afternoon, everyone, and welcome to the California Black Health Network's Health for Life series on caregiving in the Black community. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and thank you all for joining us today. Our session today is the first of a 5-part series on caregiving in the Black community, and particularly today, we will be talking about the current state of care and disparities in caregiving for the Black community. I'm excited about the topic, and I think it's definitely an important one for us to discuss and uplift for our community. And we're very fortunate to have with us today Malcolm Harris and Juan Guerrero from Caring Across Generations. For those of you who may not be familiar with Caring Across Generations, it is an organization that focuses on families, caregivers, people with disabilities, and aging Americans to create a new way to live well and age with dignity. So we need to recognize the importance of caregivers for the Black community and understand the landscape and the current situation for our community and what we can do to be better prepared and access the support and resources that we need as we deal with these situations in our lives. Unfortunately, when you look at health disparities, and just to highlight a few examples, 4 in 10 Black men aged 20 or older have high blood pressure at a rate that's 30% higher than that of white men. In Black women, the rate for high blood pressure is about 60% higher than that for white women. And then Black Americans are also twice as likely as whites to suffer from Alzheimer's disease and any other type of dementia. And so it sounds like, at some point in our lives, we will either be a caregiver to someone we love and care about, or someone we love and care about will be a caregiver to us. And so it is very critical for caregivers to know how to be prepared, how to advocate effectively for their loved ones, and learn how we can all ensure that we and our loved ones are receiving quality care, and how to discuss the importance of, advanced care planning. It's a difficult subject that we often avoid, but it's very important. And so also with May being Mental Health Awareness Month, it is important for us to highlight the unique mental health challenges that family caregiving in the Black community we face. And in particular, Black women who on average provide the majority of unpaid care to their elders. And it's often overlooked. And I know Malcolm, one of our speakers, is going to address this today and tell us more information about how this really impacts our community, and then specifically Black women. And so Malcolm will also talk about Caring Across Generations report that specifically focuses on California. Like in California, care can't wait. And it focuses on really highlighting some of the disparities in the Black BIPOC community, and also highlights what we can do to build a care system that works for all. So before we begin, I want to recognize one of our sponsors, Antoine Cook from AARP, who I think should be on today. So Antoine, are you here? And if so, can you unmute? There you are.
Yes.
Yes, can you unmute and turn on your video? So nice to see you.
Thank you, Rhonda, and nice to see you as well. I just wanted to take an opportunity to just say a few words from AARP and appreciation for everyone that's here this afternoon. And depending on where you are, it could be a different time of the day. We're so excited to start this series with California Black Health Network, a partner we started working with last year. Rhonda and her team have been magnificent in working with us the last couple of years, and we're looking forward to doing more with them in the future. And this conversation around caregiving in the Black community is critical for those who are caregivers as well as care recipients, because as a caregiver, it's so important to not only be prepared as you can be to be a caregiver, which oftentimes you don't get a chance to do, but also to know how to better take care of the person you're taking care of, which oftentimes is a family member or a loved one. And so this conversation is something that we're looking forward to doing over the next 5 sessions, and you'll be notified of when those are going to be. And so we just wanted to be able to welcome everyone and say thank you to California Black Health Network for partnering with us in this series, and those individuals, Malcolm and Juan, who are going to be speaking as well. So thank you, Rhonda, and welcome everybody.
Yeah, thank you, Antoine. It's been great working with you, and I look forward to what the rest of the year has in store for us. And so we will hear from Malcolm first, and then Malcolm and both a question. So I strongly encourage you to put all your questions in the Q&A box. If you want to give a shout out to someone that you recognize who's in attendance today, please feel free to send them a chat message. But if you can place your questions in the chat box in the Q&A box at any time. For the session today, everyone will remain muted and off camera. Again, if you have any comments, you can put your comments or thoughts in the chat box and questions in the Q&A box. But before I introduce Malcolm, I just want to talk a little bit about California Black Health Network, just in case there are a few people on the call today who may not be totally familiar with us. Even though we've been around for 40 years, we just recently had a big celebration in Sacramento on Thursday night. But even though we've been around for 40 years, I recognize that there's still people across the state who may not be completely familiar with who we are and what we do. So just in general, our vision is to create a California where every African-American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we do that every day by working to ensure that all Black Californians, regardless of how well educated they are, how much money they make, where they live, who they love, how they identify, what their housing status or situation is, or even where they're from, has access to high quality, equitable primary as well as behavioral health care, and avoid unnecessarily succumbing to disease. And so our first speaker for today is Malcolm Harris. Malcolm is the Associate Director of State Programs or Campaigns at Caring Across Generations. And Malcolm, I've had the pleasure of meeting and getting to know him last week while we were all in Sacramento together. But just in general, Malcolm, again, as I mentioned, is the Associate Director of State Campaigns for Caring Across Generations. He was born and raised in Oakland, and I think is very proud of that. He has also been a community and labor organizer, moving campaigns around the country, most recently at the Los Angeles Black Workers Center, where Malcolm led a team of organizers moving a statewide coalition and campaign called Black Workers United to create a stronger workforce or workplace protections for all California workers. This coalition won a victory in 2019 with the creation of a Civil and Human Rights Office in the city of Los Angeles to address workplace discrimination, particularly for Black workers. And Malcolm is also a funk music junkie, I would assume mostly from the 70s, but you can correct me, Malcolm, if I'm wrong. And he currently lives with someone who he is a caregiver for, and I'll let him tell you all about that. But he believes that when Black families win justice, the whole world wins. And so Malcolm, I'll turn it over to you and you can take us from here.
Thank you, Rhonda. Much appreciation for that glowing introduction, and also for putting up this image of my Umi, my grandmother, Lutfia Ali, who just turned 93 a month ago. And she constantly reminds me, I told her I said 94. She made it a point to remind me, no, I ain't there yet, but almost. So again, thank you for that. So again, Malcolm Harris, Associate Director of State Campaigns with Caring Across Generations, and I'll talk more about Caring Across Generations in a second. But also just wanted to lift up the importance of this conversation. And my work is, you'll meet me, and then also our senior California organizer who's here with us, Juan Guerrero, who helps to manage our California-based campaign. But we actually have a couple of campaigns across the country that we work in, specifically around these issues around caregiving in Georgia, Illinois, Michigan, and then also supporting work in New York State. And we'll talk about that a little bit more, along with our work here in California for a nationwide coalition that I manage called Care Can't Wait in the States, which is, as we're talking today, we'll be talking about the fact that a lot of these conversations about care are not unique to Los Angeles or San Francisco or Sacramento or Richmond or Vallejo or Desert Hot Springs or Riverside or a lot of our Long Beach are the cities that we're in, but they are national conversations. Many of us are getting older. And even if we're not getting older, we are still, well, all of us are getting older, but we will all at some point require some level of care. And my caregiving story starts off young. I mean, you know, my family, when they came here to California in the 50s, when they migrated here, like a lot of us here, when they came in the 50s and the 40s, and they landed in East Menlo Park and in East Palo Alto, my grandmother here in the picture, Sister Lutfia Ali, was known as the caregiver in East Menlo Park. Folks knew between East Menlo Park and East Palo Alto, if you needed someone to take care of a family member, then Miss Ali was that person to go to. But she was really just a part of a whole community network that I grew up with, where everyone sort of understood that at some point we were going to be responsible for mama or daddy or Madia or Mima or whoever it was, or maybe, and even as we were taking care of our own families. And my grandmother was an example of that. She juggled the caregiving needs for her family as she took care of her mom, and also took care of other folks in the neighborhood and the community. And when I was 17 and first started at UCLA, because of, you know, how expensive childcare is and school is in general, I took on that whole caregiving role for myself. And I had my brother with me for like the first 2 years at UCLA. I would take my 1-year-old brother, pull our diaper bag together, and take him on campus with me, because that's what family does. And it was just sort of understood that you take care of, you know, your siblings. And I'm the oldest of 6 children. And as I got older, I realized that, you know, that was just sort of normal for me. I'm used to taking care of my family, and building off of the example of my grandmother here, and the importance of, again, I think people call it paying it forward now, but I think that many of our communities for generations have always had that pay it forward understanding that we are responsible for each other. And so that has led me to this work, which I am proud of, and that I am continue to build with my grandmother. And as mentioned, I am a caregiver for my grandmother, but also for her daughter, my mom, who turned 74 this September. And also wanted to point out that caregiving doesn't just happen in a vacuum, that my mom who's a UC Berkeley graduate, has been on the streets in Skid Row for over 20 years. And if anyone knows or has been in downtown Los Angeles and Skid Row, then you'll probably notice that, and we'll spend more time talking about this in our presentation, but that, again, care doesn't just happen in a vacuum, and that care is not just about the caregiving itself, but it's also connected to a bunch of other issues, connected to what it means to provide care. And so as my mom comes in and out of, from the streets, and when she needs help, that's also a piece of the caregiving that I feel like I'm responsible for as her child. But also that many families across the country and across California and Los Angeles are where the deep issues of houselessness in many of our communities, and that impacts all Californians. But at 6% of, or 8% of LA County's population, or 5% of San Francisco County's population, Black folks are overrepresented in all of those demographics when it comes to housing and lack of access to housing. And we'll be spending more time talking about that too, because most people, when they age or when they need care, prefer to have that care at home or in their communities where they draw strength from. And so the deep issues, so we can't ignore the deep issues of housing, lack of housing in unhoused communities as we talk about care and the impacts of displacement, gentrification, mental health, unemployment or underemployment when you're hustling 2 or 3 jobs to just create one decent salary. The importance of understanding all of that when we talk about care. So we'll be spending some time talking about that too. And I see that I think folks are adding pieces in the chat, but I think it's important that we talk about our stories, because I think our stories especially our care stories across California, are an important part of the work that we do, and also making sure that we understand those stories connected to how we build in relationship and coalition with partners. So that's a little bit about me and about our work, and I am going to start our presentation, if that's okay, Rhonda?
Yes, it's all yours.
All right, thank you. So gonna lift this up and hopefully everyone can see. So again, my name is Malcolm Harris. I'm with an organization called Caring Across Generations, and I manage our Care Can't Wait in the States, our Care Can't Wait California coalitions. Oops, 1 second. That is not working. Okay. And so I just wanted to take a second to point out our team. So this is the team of folks across who support our work here in California. And this gentleman right here with the flower on the side of his head is Juan Guerrero, who is our California senior organizer and who moves a lot of the work here in California. And again, California is a huge state. So our brother here is moving a lot of work. And then the other folks that you see here, Angela and Kathy, support our digital and policy work. And then Jamie Worker and Yin Lama here at the bottom are associate directors of policy and research who complement the work that Juan and I are building for California, but also again across the country, because this is a national conversation, but we're focused on California today. And so again, as I said, our mission is national. And these are some of the states that we are doing work in. And as I mentioned, just want to talk a little bit about the fact that the context shaping the care crisis nationally and in California. And again, emphasizing the fact that care doesn't happen in a vacuum. People are living longer and many are more getting older. And I, knock on wood, see that myself every day when I look in the mirror and wake up. And 10,000 Americans that turn 70 every day are turning 70 every day. And by 2025, 1 in 5 Americans will be over 65 years. But as we're getting older, the care costs are skyrocketing. So over $50,000 is the annual cost to hire a home health aide, while the median cost of childcare in the US is nearly $10,000. And here, when we talk about home health aides, our California system is our IHSS workers, in-home supportive services workers. But one thing to keep in mind about California is that in California, Black women are aging into poverty. 2 years ago, the California Department of Aging released a report called the California Master Plan for Aging. And on page 7 of that report, they mentioned that more than 2 million people in the state are aging into poverty. And out of that 2 million, 45% or over 60 are Black women. And Black women are adults who have no retirement savings. And if they do, roughly half have less than $10,000. And I should mention that when we talk about Black, we are talking about, as Rhonda mentioned, we mean folks who are African Americans. So for a lot of us, we come from Texas and Louisiana, and then Mississippi and those other states, Arkansas, but also Black immigrants. So that includes continental Africans, Caribbean folks from Black people from Mexico, and yes, there are Black Mexicans, Black Salvadoreños, Black Nicaragüense, Black Panameño, Colombianos. So those are who we mean, those Black people. Oops, 1 second. Jumping ahead of ourselves. So again, and who we are. So we are, as I mentioned, we are an organization that represents and a campaign that represents people who are caregivers. So most people think about caregiving. When they think about caregiving, they think about the almost 700,000 direct care workers here in California. And those are folks who are IHSS workers. So they are paid workers who are mostly represented by SEIU Local 2015 or Ask Me UDW 3930. And they make up 700,000 of the in-home supportive services workers here in California who provide direct care. But the number of people who are just unpaid family caregivers like myself are all close to 7 million of us here in California. So who we are is we are a campaign and an organization that for the last 12 years has been organizing around both of those communities of caregivers. So the people who are paid to be caregivers, so those IHSS workers, but just as importantly, the overwhelmingly majority of folks who are 10 times the number of IHSS workers who just provide care to our aging relatives or to a disabled child or a disabled community member, while we're juggling childcare. So many of us are mamas or grandmamas or madias or mimas or abuelas who are taking care of an aging or disabled person, loved one or community member, and then also having to juggle childcare. And it's funny that Antoine is here because we've been having conversations with AARP about the fact that the high numbers of grandparents who are providing care to their grandchildren. So who we are is an organization that's been organizing around those caregivers, but also taking what we call a model called universal family care, which takes into consideration that folks aren't just aging or needing care, but that we are aging and needing care while we are connected to family and community. So so our campaign is called Universal Family Care, where we look at the fact that care doesn't just happen in a vacuum and it doesn't just happen outside of community. It is connected to family, it is connected to local community, and the importance of being able to provide that care at home in your local community. And our campaign, our work is focused on the three areas that we think are the primary needs when it comes to what we call, again, universal family care. And that's long-term supports and services or home and community-based care. So that understanding that by 2030, more than 1 million older adults or persons with disabilities in California will need assistance with self-care, and that the majority of Californians prefer care at home and in community. And that's really important for us to think about, especially when we look at what care looks like, and especially when we look at issues impacting local communities across California, and just the struggles that a lot of our communities are having to just stay in their community, and more importantly, to stay in their housing. So we talk about care connected to home and community-based care, long-term supports and services, meaning the care that a person will receive, but also the child care that families need. And so the average cost for, again, taking into consideration that the average caregiver is a mom who needs safe and reliable and accessible child care. And in a state like California, the average cost for full-time early child care and education, or ECCE, ranges from over $11,000 to over $16,000 based on age. And when you think about the unemployment and underemployment issues that many of our communities have, just the importance, how expensive and unaffordable childcare is, and taking into consideration that the median wage for childcare workers is only $13.43, nowhere near enough to support families trying to make ends meet. And that's data taken from the Center for the Study of Childcare Empowerment, our employment. But even as you're providing childcare, if and when you need to take time off from work, and I know this happens for me with my Umi, who you saw in the picture earlier, that many of our families and communities need access to paid leave, and paid leave that actually will allow you to continue to provide care when you're not working. And over 50% of people working in California are responsible for the adult care needs of family members. Yet the average caregiver who's over 50, who leaves the workforce to care for a parent, loses over $300,000 in wages, Social Security, and private pensions. And so for us, it's again taken into consideration that here at the bottom, like it says, care doesn't happen in a vacuum. So then when we think about these issues that we are thinking about how we knit together and create a system that creates universal access for all of our families across California. And so the next slide. So again, care doesn't happen in a vacuum. 2 years ago, the California Budget and Policy Center, which is kind of like the Wonka, the think spot for thinking about policy across the state, has been doing a series of articles or think pieces around the issue of homelessness in California and the inequity connected to that. So in their findings, they found that people of all ages and backgrounds fall into homelessness, and Californians experience homelessness across every state, every county of the state. But there are deep racial inequities in who experiences homelessness in California, with individuals who are Black facing a greatly disproportionate risk of homelessness, as well as American Indians or Native, Alaskan, and Pacific Islander individuals. So basically the BI and the POC, the Black and Indigenous communities, are across the state and really across the country. Again, while all of us are struggling, Black and Indigenous communities and Native communities are struggling in ways that, as you can see here in the corner, that across California, and I think we all know this, that Black people disproportionately are homeless in California. For those of you who may know, LA County released a report 3 years ago, maybe going on 4 years ago, about the state of emergency of Black homelessness in Los Angeles County, where again, at 8% of the county, Black people represent 40% of the unhoused. It's the same in San Francisco County, 5% of the population, but 40% of the unhoused. Similar Long Beach, similar in, well, Long Beach is in LA County, but similar throughout the state and really throughout the country. And so again, for us, when we talk about care and caregiving, we have to think about the fact that care doesn't just happen in a vacuum. And so for our campaign here, our campaign is based on what we call, it's a Black-centered campaign. And with the understanding that structure, systems, and building policies are the reasons that these things happen. And so our approach is that in order to build a campaign that works for all Californians, we need to have a Black-centered care foundation for California. And these are images that I brought to just sort of sync the fact that to the left, to the upper left here, that again, the California Budget and Policy Center has lifted up that after peaking early in the pandemic, the unemployment rate for Black Californians remains high. And again, when I say Black, I mean Black, whether we're African Americans, continental Africans, or Black immigrants, African Latinx, because Latinos are not a race. So Black Latinos, Black Caribbean folks, that we are disproportionately represented when it comes to unemployed and underemployed, meaning folks who who are juggling multiple jobs to create one decent salary. And that to the right here, affordable aging is becoming harder. As I mentioned here, this is the piece from the California Master Plan for Aging that shows in this column here that Black women 60 and over are the primary group. Again, 45% are aging into poverty at a rate higher than anyone else. And that is not by accident. And that this is all connected to the fact that these are not new conversations. This is the middle tile here in the slide, shows that this is from the LA County's recent release of their report in the state of Los Angeles County, shows that this is a piece that shows that housing, our fair housing law in California and the fight for anti-racism goes all the way back to the 50s and before that. And that pretty much every organizing issue from the Black Panther Party to the Black Lives Matters has always included platforms around police abuse, stopping police abuse, the high incidence of unemployment in Black community, and the need for stable and affordable housing. That has been a consistent piece for generations in many of our communities, specifically Black communities here in California. And so we're going to spend a little time talking about the fact that this is all rooted in slavery, that enslaved Black women were forced to care for and breastfeed white children, and that from there, every deal or policy that's been created from them since then has kind of been rooted in that understanding of slavery and Black folks in our position. And so we believe that it's important that we talk about that, because including issues like the New Deal, because this is all part of our understanding structures, systems, and building policies that won't implement or redo harm. And so, like with some of our partners in Black Californians United for Early Child Care and Education, mentioned over and over again, that is well-intentioned as a lot of the policies that have been created for it in California are, that there's a deep need to really think about it and look at them through Black lenses and through other communities' lenses to make sure that they don't maintain generational harm. And so, again, as I mentioned, for our campaign, it's a Black-centered campaign that's looking at care here in California, the importance of Sankofa, of understanding the past so that we can understand the current systems and that we're operating under, and how we create policies that will create equity for all of our communities. And so, as I mentioned earlier, all of this is rooted in slavery, and that enslaved Black women, and I mentioned again, and I want to say this again, that there's a reason why Black women represent 45% of those aging into poverty in the state, and that is rooted to slavery, that enslaved Black women were forced to care for and breastfeed white children. And ever since then, pretty much every deal or agreement that's been made has been set up in a way that kind of maintains the second-class nature of Black communities in general and Black women in particular. So for those who remember the New Deal, which was a deal that was signed in the middle 1900s, where domestic workers, like child care providers and farm workers, were specifically written out of the Fair Labor Standards Act of 1938, because they aren't white, and while white professional workers gain labor rights. So, and the New Deal, and you can look this up yourself, specifically cuts domestic work out. And when we think about currently who domestic workers are in 1938, domestic workers overwhelmingly look like me, or like my grandmother. And so there are laws that have been written in, whether they may not name Black women or Black communities, the way that they are written may as well be impacting us. And are absolutely impacting us. And so from the 30s and going into the 50s, Black women are limited to jobs in domestic work and paid poverty wages by design. White people continue to write and benefit from racist laws that allow them to acquire more wealth. And then when we come to the 1980s and 90s here, Ronald Reagan equates Black women with fraud and laziness, using the lie of the welfare queens. And some of you may be old enough to remember the welfare queen label that was that I know I remember. And government programs require families to prove that they are deserving. Meanwhile, the white owning class benefits from billions in corporate welfare dollars under a trickle-down economy, proven not to work. I should also say that in California, what a lot of us may not know is starting in the 1970s and throughout the 80s and the 90s, that home care workers were organizing themselves into what we call the IHSS system. Back then, it hadn't been officially created, but here in the late 70s, Black women who were Black African American and Black immigrants, so Black Central Americans and continental Black African women, organized themselves in the 1980s and the 90s because they recognized the fact that they were stuck in domestic work. And their organizing efforts led to what the system that we call the IHSS system, or the In-Home Supportive Services system, which again, most folks don't know, that was moved and organized by Black women, again, Black African-American and Black immigrants. And today, half of child care providers are forced to live at or near the federal poverty line, and state and federal policies underfund child care, avoid protections for workers, and uphold the legacy of racism. And so we wanted to just point out the fact that, again, in our system, as we look at our work, we look at it through the lens of universal family care, connecting long-term care to paid leave and child care. And that, again, many Black child care providers and other child care providers, mostly women of color, continue to be locked into some of the same issues. And as I mentioned, we are uprooting racist child care and other policies and seeding new policies for racial equity. And for folks who've been pushed down, but are now leading the way. And to be honest, have always been leading the way. And Black women in particular have always been one of those communities of folks who have led the way for many other communities and for our own families. And so for us, again, when I mentioned this before, in order for us to talk about care here in California, we have to be thinking about California intersectional care. So this is an event that we did where you see this sister here with the babies. We did an event in South Central in Leimert Park. Folks may recognize that. It's not too far from my house. But on the sides, as you probably noticed, intersectional care, again, for our communities means that we have to be thinking about care connected to housing, connected to income and employment, and safety and justice. And that, again, care doesn't happen in a vacuum. And don't need to mention it again, but we are doing whatever we can to uproot racist policies that have continued to lead many Black communities and Black women in particular in the situations that many of our communities find themselves in. And so our framework for moving this, as I mentioned, is universal family care. It's a foundation with the understanding that a Black-centered foundation to create a whole family care system. That's pillars are, again, the connections of long-term care to child care and paid leave. And all of that is what we call California Care Can't Wait. And so wanted to talk a little bit about what will we need to make universal family care in California a reality. So in addition to all of the pieces that we're thinking about, that's the first piece, is we have to be clear about who we're trying to address and address some of the bottom line foundational care related issues for, and that's our Black foundation. And so we use that to move into an agenda around long-term care that creates a statewide care agenda that includes statewide bargaining for IHSS workers, because again, as I mentioned, the IHS system that we currently have was created by Black women, including Black immigrants. They are still some of the lowest paid jobs with some of the worst benefits. And so continue to want to make sure that we build those out and that we want to expand those rights for those workers. For paid leave, we want to expand paid and sick leave, and we want to protect caregivers from the employment discrimination wherever they may be working. And we also want to make sure that paid leave, not only which currently pays out 55% when a person has to take time off, but that we just last year passed legislation called SB 951 that will replace that 55% payout and expand that up to, we're pushing for as high as 90%, but right now it's at 80%. And then we also want to make sure that there are child care policies that look at rate reform for providers and that keeps child care subsidies for low-income families available and accessible for our communities. And we can't do this in isolation. So we be talking about all of this. We talk about having the Black centered foundation, but we can't move this in silos. So again, this is a statewide campaign. And so our solution again is Care Can't Wait California. And these are some of our foundational partner organizations. So we've got the Filipino Worker Center, which organizes across the state around the issues connected to Filipino communities. Hand in hand, the Domestic Employers Network, working really closely with UDW, United Domestic Workers, Local 3930, the California Work and Family Coalition, the California Alliance for Retired Americans, Senior and Disability Action, Parent Voices, the Sibling Transformation Project, Black Californians United for Early Child Care and Education, and y'all. Our solution has to be that we need to make real relationships with each other across the country, so that that's based in a Black foundation that will create wins for and caregiving wins and stronger caregiving resources for paid and unpaid caregivers and the people who need that care across the state. And so our work is, as we mentioned, to make care central in any public discourse and any legislative vehicle, to project a constant, relentless demand to win on care from a powerful, diverse base. Again, we have to build together, and that we build with and across our California partners. And that we also create a community-led vision that centers Black care wins as wins for all Californians. And y'all, for some of you who know, just being here in California and talking about Black issues is not the easiest thing, and it can be hard. And making sure that we're also bold and unapologetic about lifting those issues up, and that we link up the fact that care doesn't happen in a vacuum, so that we need to link the intersections. As Rhonda mentioned at the opening, we have to talk about mental health, we have to talk about housing, we got to talk about incarceration, etc. And that's it. Thank you for your time.
Thank you so much, Malcolm. I don't really know what to say. That was a little more overwhelming than I anticipated. And I appreciate you, first of all, sharing your story and providing information about your organization as well as the campaigns that you're involved in. And so I want to ask our wizard behind the scenes if you can pin myself, Malcolm, and Juan, and happy to take questions. We do have one in the chat box, in the Q&A box. And the person says, I'm shocked that there are 7 million unpaid caregivers like myself. I can't find information here. Hold on. I don't know why they started making the font so small here in Zoom, but can I find information here on long-term care placement for my elderly mother with dementia and employment opportunities for my disabled son? So Malcolm, do you or Juan want to respond to that question?
Juan, do you want to take it? I'm good either way.
Yeah, I mean, if you'd like, we could talk offline about it too, because depending on where you live, we could get more specific resources. But absolutely, I feel like the narrative that hey, a lot of folks just take unpaid work as it is and don't really recognize that it's something that there's a lot of solidarity behind. There's a lot of people out there who oftentimes don't even see themselves as caregivers. So something we're regularly doing is just trying to make sure that we reflect on am I an unpaid caregiver? What does that mean? Are there resources available? How does that look like in one community versus another community? Are there better resources in certain counties? And being able to draw that statewide narrative is something that we're actively doing. But for more specific resources relating to your family, I'm happy to connect offline and try to connect you with the right people about that. I want to make sure I like individualize that response a bit more.
Okay, I can let you know who that person was also. And there is someone, Tia Delante, I believe, from the Alzheimer's Association, who would like to also connect offline. So I'll make sure that I'll do the e-intro. And so, just listening to what you talked about, Malcolm, a lot of that has to do with kind of what the result is, has to do with the social determinants of health, right? How much money we make, where we live, the access to resources, whether it's healthcare or other type of social services. And so, this is a problem that is pervasive and leads to health disparities, not just inequities, but also health disparities. And when I hear you talk about, Black women, the number of Black women aging into poverty, that really frightens me. So I want to talk a little bit more about how the universal family care proposal or campaign that you talked about can really kind of get ahead of the curve and address some of those issues and hopefully decrease that. I think it was 45% that you said that pertains to Black women in California.
Yep. Is it okay that I take this one?
Whoever, yes.
Yes, to your point, Rhonda, it is definitely about the social determinants of health. But that's also a slightly fancy word for white supremacy. And the fact that anti-Blackness is real and alive and well. And so I think, I want to say that out loud, because I think it's important for us to really kind of name this, which is why we take such a point to lift up these pieces and connect this to slavery, because these are generational issues. They are generational issues in ways that impact Black communities and Black women in ways that we should just want to make sure that we name too. As we create a solution for them, for those, and that we feel comfortable thinking about that. So a couple talking about that openly. And more importantly, that foundations and funders and folks that we work closely with also understand those pieces. So there's a couple of ways that we're doing that here. We have recently started to organize around creating a Black only space around care. So working with policy experts across our paid leave, childcare, and long-term care experts, and also people who are directly impacted on the ground. So IHSS workers who are Black, to come together in the space and identify, well, what are the issues and what can we collectively, as we're doing our work across the state, how can we create that lens to look at policies as we're in partnerships and working closely together with our partners. And much appreciation for one of our California Care Fellows, Felicia Ford, who's here. And I just wanted to shout Felicia out because she's an IHSS worker who has a small nonprofit herself, Black woman who has been doing a lot of this work. And I think it's also making sure that we're connecting those links to those folks who are doing the work. Because what we're finding a lot of times is that in the organized spaces, and I see in the chat that Alzheimer's and other groups are lifted up, AARP, who sit in the organized spaces that, and I'm not calling anybody out here, but that Black bodies sit in these spaces, but not necessarily Black issues. And there's a difference. And so we're creating this Black only space to talk about those issues and to talk about how can we create the lenses that we need to be looking at and working together across the state. And then also figuring out maybe we need to create Black care spaces for each other, how do we identify and create a path forward together. And so that has been an intentional part of our campaign, is to work with those folks who are interested in doing that. And we've gotten really good reception from folks. And so, and particularly a lot of the partners that we've named to really support a vision like that. So I hope, and that also means bringing in folks who do work connected to housing, mental health, those care aligned pieces too. So bringing those pieces in.
Yes, and so, I'm sorry, go ahead.
No.
Yeah, and so, last week, we were all in Sacramento. Well, not, unfortunately, Juan wasn't with us, but a group of us who we're part of the Health Equity Advocacy Training Program. We're in Sacramento advocating for issues that are impacting the Black community. And so I think it's kind of some of the things that you mentioned earlier, right? That this doesn't happen in a vacuum. So how can we and the folks that are on this call today kind of get involved and really step up and amplify their voice and advocate for more benefits for caregivers who, you know, want and need to, and sometimes don't have a choice in taking care of their loved ones. So what can people do? And Juan, you want to take that one?
Yeah, I think a big part of it,
Either one, yeah.
I think a big part of that is advocacy, and a big part of that is being able to like understand like, hey, like this has been a system based off like white supremacy that has led to policies that have done a lot of harm to the community in general. I feel like there's been that observation. I feel like there's these data scientists now that are getting up to speed on what's already been understood. And I think it's a matter of being able to now really take that information and being able to analyze and be critical with how we approach policy solutions now. So when we talk about long-term care, let's talk about it from like a Black-centered angle, because we recognize that when we talk about long-term care, how it has disproportionately left behind Black communities is something we need to be intentionally talking about when we talk about every part of our policies. When we talk about housing, when we talk about mental health, when we uplift those who have been most marginalized by these harmful policies, everyone benefits. And that's a conversation that needs to be happening with non-Black people of color too. When we recognize that the intentionality behind a Black-centered campaign is to be able to draw that framework and so that everyone could benefit. It's something that just needs to be talked about in all levels of policy, maybe at a local, community level, statewide level in Sacramento. It just needs to be talked about intentionally so that the harm that's been done could start getting solutions on how we could undo that harm, and by having that intentional discussion.
Great. And I know one of the questions that Antoine kind of texted me about was around, you know, the pillar related to long-term care and your universal family care campaign. Does that include access to affordable long-term care insurance, or how exactly does that work?
Can you repeat that? I want to make sure that I understand.
Yeah, so one of the pillars of the universal family care campaign that you mentioned deals with long-term care. So does that include access to affordable long-term care insurance, or it's structured some other way?
Yes. So is it okay that I take this one? So our North Star is what, as we mentioned, is universal family care, which is universal long-term care. So that means universal access to that. And so we sit on statewide and national caregiving spaces to lift up that long-term North Star. And here in California specifically, I think I mentioned when we were all together, we were doing our our visits, our meetings. That right now the state is creating a long-term care social insurance benefit for all Californians. It's being moved through the long-term insurance task force. Juan and I manage a campaign that brings together a bunch of the partners that you mentioned before around meeting that task force. So right now they're creating a model for what that benefit will look like and how it's going to be paid. I'm actually in Sacramento right now, meeting with policy experts around looking at what an equitable funding source would look like for that, and making sure that we have a social insurance benefit that's as equitable and accessible as for all. And so we are actually sitting in those spaces. And so along with us sitting in those spaces, making sure that we're lifting up these issues and talking about incarceration, talking about mental health, communities that'll be left out, including immigrants, and naming Black immigrants along with that, that we make sure that we're situated to be able to be a part of those conversations and influence those conversations. So we are deeply involved with the state's social insurance benefit that's being built out right now.
Okay, and Juan, was there anything that you'd like to add to that?
And I should mention too, that on for the social insurance benefit, that as Antoine pointed out, his boss, Joe Garbanzo, sits on the task force. And we also sit in the space called CADA, the California Aging and Disability Alliance, with AARP, with one of his colleagues, and in that space around. So there's definitely alignment around making sure that we're thinking about this together.
Okay, great. And I want to check and see if there are any questions by chance in the chat, Amber, or I see there's a lot of activity in the chat, but can't tell if there are any questions. But just wanted to check in to see if I missed anything, or so that I don't miss any questions.
Yeah, you did already touch on one of the questions that Antoine had. Another question is just kind of, or I guess a comment leading to a question. It would be great to hear how the efforts in the policy and advocacy space will be incorporated into the efforts of the Universal Healthcare Plan. And so he also mentioned, Malcolm mentioned a Senate bill, which is great. And if there's anything else that you can elaborate on that hasn't already been stated.
Either one of you guys. I think you kind of answered the question earlier, but if there's anything else to add.
Well, so I mentioned the long-term insurance task force. We're also working really closely, and Juan can talk about some of the other pieces of legislation that we're working on connected to paid leave and childcare, and how we're supporting those pieces too as our priorities to get to our North Star of universal family care and access for all. Do you want to take that, Juan?
Yeah, I'm going to tie in what Petra mentioned, is being able to speak to elected officials about family caregiver issues. And I think just like we did here when we're trying to tie together, when we talk about family caregiving issues, let's talk about the intersection of how paid leave policy goes into that. If the high cost of childcare offsets your ability to be able to have a good childcare system for your family, what does that mean for your ability to take care of your other family members? So around some paid leave, there's some legislation moving right now around caregiver discrimination, because what if your employer says, oh, this person's a caregiver, they're always in and out and taking paid leave to take care of their family members, and that's someone that is not as reliable as someone that doesn't have a family obligation to the same capacity. And that's a form of discrimination that we're really trying to identify as this is not equitable. When we talk about these policies, we need to make sure that we not just talk about it in one way, but being able to recognize how even with paid sick leave expansion that we're trying to advocate for from 3 days to 7 days, being able to recognize that a lot of upper and higher class jobs are oftentimes subsidizing the state sick day policy with their own employer sponsored sick day policy, which is great, but recognizing that lower income jobs have also just done the bare minimum when it comes to sick days that are available to their employees, and being able to recognize that as an anti-Black policy, and being able to recognize that when we have those conversations in those spaces, to be able to identify that, because it's an entire system that has been built off white supremacy, that has disproportionately compounded generation after generation, that has set up these conversations in a way where we might not identify it at first, but we need to critically make these observations to be able to have those conversations in an honest way that really starts addressing that generational harm, rather than just mask it through other terminology. We need to be able to talk about that critically. And when we talk to legislators about family caregiver issues, being able to paint the entire picture of how paid leave, long-term care, and childcare all relate to this broader care system that isn't afforded to a lot of people, and how if it isn't afforded to people, what does that actually mean, and people's ability to be able to thrive in California, and who's going to get left behind if that system isn't fixed.
Great. And I know we could talk about this all day, but I can't believe it's an hour's passed already. And I do see that Antoine, I think, is back. And Antoine, if you're not, two places at the same time, because I know you had to jump off for a few minutes, just wanted to give you an opportunity to share your thoughts, share information about what AARP is doing around this issue, if you're actually there. Maybe not. Yeah.
Yeah.
Great.
I'm a little bit here. And so, yeah, thank you, Rhonda, and everybody for Malcolm and Juan for sharing what you shared, because it's so very critical to um, caregivers and resources and information that they have and need. The only thing, because I mean, shared a lot of great information. Um, we are planning at AARP. We're planning on um, getting more involved with some caregiving advocacy that we're going to be doing, specifically around projects and programs that we're looking at. There's not a whole lot of detail I can share right now. I'm kind of talking in vague terms because it's still literally being put together as we speak by one of our lead staff persons, Nina Weiler Harwell, who sits on the master plan for aging and a lot of our caregiving lead projects and things. So there's going to be more that we're going to be sharing about that. And one of the things that we're looking to do is continue that drumbeat, like both Malcolm and Juan have also shared. Not let the issue go away. We're going to be at KJLH Women's Health Expo and a bunch of other events and things. We're going to have teletown halls with our members and the community about things that we can do together, working with Alzheimer's LA, Alzheimer's Southern California, and other organizations to be able to, where we can, bring this message to the Black community. Because as you both have shared, there's so many pieces of, I don't even know, our environment, our society, where things have just been not adequate, not equitable. And even if you look at, and I'm going to go on a little bit of a tangent, but even if you look at the whole conversation about if folks have been up to date on reparations, right? There's a task force that made some announcements last week. You know, all of that plays into a really large conversation around inequities and things like that. So we're keeping an eye on a lot of different things, but we're planning to really start doing more. And we've done a lot in the past, but doing more when it comes to caregiving, and especially in the Black community.
Okay, great. Thank you, Antoine. And I want to thank you, Malcolm and Juan, for being here today and sharing all that great information. Thank you so much. And would like to talk offline about what CBHN can do to help support your efforts and how we can work together. Because, you know, everything that we do is all about equity, right? Whether it's health or income, where they're all interconnected. So would love to chat with you about how we can support your work. And so time has, like I said, flown by. Just a few more things that I'd like to share before we wrap up today. For those of you who are not already following us on social, you can connect with us very easily at Your CBHN on Facebook, Twitter, as well as Instagram. We're the California Black Health Network on LinkedIn. You can join in on the campaign for Black Health Equity, where we actually are not only engaged in advocacy, but really doing our part to improve all aspects of health equity and close that gap in life expectancy and disparities for the Black community across California. And so we have an event coming up. For some of you on today may have participated in our Let's Dismantle Diabetes series. We have session 3 coming up on May 18th at 2 p.m. Pacific time. It's Let's Dismantle Diabetes session 3, My Diabetes, Treating versus Treatment, again with our speaker, Courtney Walker from Novo Nordisk. So if you haven't registered already, go to our website under californiablackhealthnetwork.org/events and register. It's coming up next Thursday. So can't believe May is approaching the midpoint mark, but please do join if you've enjoyed the first 2 sessions or curious about what we're going to talk about in the session next week. So thank you again to our speakers. Thank you to the participants who attended today. Have a great afternoon, and we look forward to seeing you soon. Take care.